Parotid tumors represent about 80% of salivary gland tumors. Absolutely not. In fact, almost 80% of parotid gland tumors are benign. But even if they are benign, their surgical extraction is indicated, since otherwise they can continue to grow and become malignant. When speaking about tumors, the most important thing is, of course, its complete removal. But when talking specifically about parotid gland tumors, there are two important aspects to consider. First, the facial nerve, which is in charge of facial mobility, goes through the parotid gland. And second, the removal of the parotid gland may result in unwanted scarring and an unwanted facial subsidence. Surgeons' experience and good practice are essential tools to preserve the facial nerve and therefore facial expression of the patient. But apart from that, in our Maxillofacial Institute, we have a neurostimulator which allows us to detect the proximity of the facial nerve and its branches, and therefore it makes the procedure much safer. As for the possible aesthetic complications of the procedure, in our Maxillofacial Institute we have implemented several techniques that minimize the unwanted effects. Besides, we fill the surgical defect with a pad of subcutaneous fat. But as with any surgical procedure involving the facial area, it is very important to put yourself in best hands, since our face is our unique identity and the showcase of our emotions. Because our approach to surgery is minimally invasive, we perform a tiny incision similar to those performed for facial lift procedures. Moreover, with our techniques, we are able to perform a very safe procedure and to get a very fast recovery of the patient to normal life.